All right, so today we're going to be taking a deep dive into substance abuse prevention
Oh,
and looking at it from a public health perspective.
cool.
So we're really talking about strategies and programs and, all those things that can actually make a difference in communities.
Yeah.
Not just the Just Say No campaigns of the past.
Right, exactly.
You sent me some excerpts from what looks like Substance Use and Abuse Prevention 101,
Mm-hmm.
a college syllabus.
All right.
And then you also included a couple of research articles as well.
Yeah, I did.
So we've got lots to dive into today.
Awesome.
So one of the things that I was looking at in one of the articles you sent, it said that over 40 million people in the U.S. in 2020,
Okay.
aged 12 or older,
Wow.
had a substance use disorder,
Yeah.
which
It is a lot of
is a huge number. It's a really big problem.
It is a huge problem.
Yeah.
But I'm kind of curious. So before we even get into talking about solutions and, all the ins and outs of everything.
What is a substance use disorder?
Okay.
And how is it different from just like using a substance?
Right. That's a really important question.
Yeah.
The syllabus actually dives into this a little bit.
Okay.
So substance use is pretty broad. So
Yep.
it's like having a glass of wine with dinner or, even just having a cup of coffee to wake up in the morning.
Right.
But it becomes a disorder when that use starts to negatively impact your life.
Oh, okay.
So think, missing work deadlines because you're hungover,
You're right.
relationship problems, legal issues,
Okay.
things like that.
So it's less about the substance itself.
Exactly.
And more about the consequences of using it.
Yes, exactly. And then within substance use disorders,
Okay.
there's a whole spectrum.
Mm-hmm.
It ranges from what we call abuse to addiction.
Okay, so what's the difference?
So abuse might be like repeatedly using a substance, even though, it's causing you problems.
Oh, okay.
Whereas addiction is when you have that physical and psychological dependence. And that includes things like tolerance and withdrawal symptoms.
So your body's like physically relying on it
That's
to
right.
function,
Mhm.
and then stopping can be really hard?
Yeah, it could lead to some pretty rough side effects.
Yeah.
So understanding that whole spectrum is really important for figuring out,
Right.
how do we develop effective interventions and prevention strategies?
So you've got to know where someone's at
Right. You need to tailor your approach.
on that spectrum to even know how to help them.
Yeah, exactly.
Okay, so I noticed in the syllabus it was talking about levels of prevention.
Yes.
It sounds kind of like a video game almost.
It's a good way to think about it.
Level up your prevention skills.
Yeah.
So what are these levels?
Okay, so it basically boils down to three main levels:
Okay.
primary, secondary, and tertiary.
Okay.
So primary prevention, that's all about stopping substance abuse before it even starts.
Okay.
So you're thinking education programs for kids and teens, promoting healthy activities, creating environments where substance use just isn't the norm.
So really like building that good foundation from the get-go.
Yes, precisely.
Okay.
Then you've got secondary prevention,
Okay.
and this is when someone's maybe already showing signs of some risky behavior.
Okay.
It's all about early identification and intervention to try to prevent things from escalating.
So catching it early
Yes.
before it becomes a bigger problem.
Exactly.
Okay. And then tertiary.
Tertiary prevention is when someone is already struggling with a substance use disorder.
Okay.
So this level is focused on treatment and support to really try to minimize the long-term impact of that disorder.
Gotcha.
So things like rehab programs, support groups, medication-assisted treatment
Yeah.
all fall under that category.
So we've got our levels of prevention.
Hmm.
What are the actual tools that people use?
Okay, so one tool that's often used,
Okay.
and the syllabus mentions this, is drug testing.
Oh, interesting.
And it can be controversial, but it actually plays a role in all three levels of prevention.
Huh. I always thought about drug testing as being like reactive, like in a workplace
Right.
or for like legal reasons or something.
Yeah.
How does it fit into prevention?
So at the primary level,
Yuck.
just the possibility of being drug tested can act as a deterrent,
Oh, okay.
especially for young people.
Mhm.
And then at the secondary level, it can be used to identify individuals who might need early intervention.
So it's not about punishment.
Exactly.
About like getting them help
Right.
before it gets worse.
Yeah. And then in tertiary prevention, drug testing can be used to kind of monitor progress and make sure someone is staying on track with their recovery.
So it's like a multifaceted tool
Yeah.
that needs to be used thoughtfully.
Definitely, it requires some careful consideration.
Okay, now I also saw that the syllabus mentioned the SAM-HSA 5.
Oh, yeah. SAM-HSA.
What is that?
So SAM-HSA stands for the Substance Abuse and Mental Health Services Administration. And they've basically developed this standard list of 5 commonly abused drugs
Okay.
that are often included in drug tests.
So which drugs are we talking about?
So we're talking about amphetamines, cocaine, marijuana, opiates,
Okay.
and PCP.
Okay, so it's like a baseline.
Yeah, essentially it's a baseline to make sure there's some consistency
Gotcha.
across different testing scenarios.
But, when we talk about all this testing and stuff, it still feels kind of reactive.
Okay, I see what you're saying.
Like we're waiting for something to go wrong
Right.
before stepping in.
That's a good point.
So what are we doing to be more proactive?
Yeah, and that's where prevention programs come in.
Okay, so now we're getting into like the good stuff.
Yeah.
Tell me about these programs.
So they come in lots of different forms,
Okay.
and they're designed to target specific populations and risk factors.
Okay.
And the syllabus highlights 3 main categories: family-based, school-based, and community-based programs.
Okay, so let's break those down.
Okay.
What's a family-based program like?
So one of the studies you sent actually found that strong family bonds and open communication can really significantly reduce the risk of adolescent substance abuse.
Oh, wow.
Yeah. So these programs often focus on improving communication between parents and kids,
Okay.
teaching parents how to set healthy boundaries,
Right.
and just really equipping them with the knowledge and skills to have those conversations about drugs and alcohol.
So like creating that supportive home environment
Exactly.
where you can actually have those conversations.
Right. And it's not just about saying no.
Yeah.
It's about empowering families to have those open and honest dialogues
Right.
about the risks and consequences.
That's great.
Yeah.
What about school-based programs?
Oh, yeah. School-based programs.
And I remember having those when I was a kid,
Mhm.
but I'm curious how they've evolved.
Yeah, they've come a long way.
Okay.
One interesting thing from the syllabus is that prevention education can actually start as early as preschool.
Really?
Yeah.
I mean, what do you even do with a 4-year-old?
Obviously, you're not going to be discussing like the intricacies of addiction with a 4-year-old,
Right.
but it's about building that foundation of social emotional skills.
Go.
So things like managing emotions, resolving conflicts, resisting peer pressure.
Oh, so giving them those skills early on?
Exactly.
So that then later they can make healthy choices.
Exactly. And as kids get older,
Yeah.
these programs adapt.
Okay.
So the syllabus mentions in middle and high school,
Mm-hmm.
there's a focus on peer relationships, communication skills, and assertiveness training.
Oh, that's great.
Yeah.
So they really get a whole toolkit to work with.
Yeah, and one thing the syllabus emphasizes is having these consistent integrated programs
Yeah.
that are woven into the school curriculum.
So not just like a one-time assembly.
Exactly, not just a one-off thing.
Okay.
All right, so then we've got community-based programs.
Okay, what are those all about?
So they recognize that prevention is a collective effort. It's not just on families or schools.
Right.
So these programs bring together schools, faith-based organizations, community centers, local businesses, residents.
Wow. Everyone.
Yeah, everyone working together to create that united front against substance abuse.
No, that's great.
Yeah. And it might involve awareness campaigns, providing recreational activities for youth, offering support groups for families struggling with addiction.
It's like creating a culture of support.
Exactly. And again, the syllabus really stresses that consistency and ongoing community engagement
Oh,
are key.
Yeah.
But there's another piece of this puzzle
Okay.
that I think is really interesting,
Okay.
and it often sparks a lot of debate,
All right, let's hear it.
and that's harm reduction.
Oh, yeah, harm reduction. I've heard that term a lot,
Mhm.
but I don't really know what it means.
Okay, so it's a different approach,
Okay.
and it acknowledges that, total abstinence isn't always a realistic goal for everyone.
Right, so it's not just say no.
Exactly. It's about minimizing the negative consequences associated with substance use, regardless of whether someone's actively trying to quit or not.
So meeting people where they're at.
Exactly.
Okay.
And acknowledging that even if someone is still using substances, there are ways to reduce the harm.
Okay, I like that.
Yeah.
Can you give me an example of a harm reduction program?
Sure. A classic example is needle exchange programs.
Okay.
So by providing clean needles to people who inject drugs, we can really dramatically reduce the spread of infectious diseases like HIV and hepatitis C.
Oh, wow.
And that benefits not just the individual, but
Right.
the whole community.
So it's not about like condoning drug use.
Right.
It's just about trying to make it safer
Exactly. It's
Yeah.
about taking a practical approach
Yeah.
to minimize the harm.
and hopefully help people get on a path to recovery.
Exactly. And it often works alongside those traditional prevention programs
Yeah,
to create a more holistic and comprehensive strategy.
I like that.
Yeah.
Okay, so we've got our levels of prevention.
Yeah.
We've got tools like drug testing. We've got this harm reduction. I'm starting to see how it all fits together. But one thing I'm curious about
Yeah.
is harm reduction controversial?
Ah, that's a great question.
Yeah.
And I think that's a really important conversation to have.
Oh, yeah.
It's not a black and white issue.
Okay.
There's a lot of nuance there.
All right. So where does the controversy come from?
So I think some people worry that harm reduction strategies,
Okay.
like needle exchange programs,
Mm-hmm.
they might send the wrong message,
Oh.
especially to young people,
Right.
like almost that we're condoning drug use or encouraging it.
Yeah, I can see how people might think that.
Yeah, and there's also the argument that these programs might take away the incentive
Okay.
to seek treatment
Mm-hmm.
and strive for abstinence.
It's kind of like that whole debate around, like, providing condoms in schools.
Right.
Does it encourage sexual activity or does it promote safer choices?
Yeah, it's a really good analogy.
Yeah.
It's about understanding that people are going to make their own choices. Right. And harm reduction is about minimizing the negative consequences of those choices.
Yeah. So it's about, like, I guess, meeting people where they're at
Exactly.
and providing support without judgment.
Exactly. And the research actually supports this approach.
Oh, really?
Yeah. So one of the studies you sent highlighted that people who participate in harm reduction programs are actually more likely to enter treatment
Oh, wow.
and reduce their substance use over time.
Interesting.
So it's not an either-or.
Right.
Harm reduction and abstinence-based approaches can actually complement each other.
They can work together.
Exactly.
Okay, cool.
Yeah.
So what are some other examples of harm reduction programs?
Okay, so one approach that's gaining traction,
Okay.
and the syllabus mentioned this too, is supervised consumption sites.
Supervised consumption sites?
Yeah.
I've heard about those, but I don't really know how they work.
Okay, so basically they provide a clean and monitored environment
Okay.
where people can use drugs under the supervision of medical professionals.
So it's like creating a space where it's safe
Right.
and they're not going to overdose.
Yeah, so you've got trained staff on hand
Okay.
to provide sterile equipment,
Right.
administer naloxone if there's an overdose,
Right.
and offer information about treatment and support services.
So it's not just about harm reduction in that moment.
Oh, yeah,
It's
man.
also about connecting them with resources.
Yeah, actually, and the data shows that these sites can significantly reduce overdose deaths,
That's amazing.
the spread of infectious diseases, and public drug use.
Wow.
And they also offer that point of contact
Right.
to connect with those health and social services that they might not otherwise access.
Yeah. That's incredible.
It's a really good approach.
Yeah.
Now, another really important aspect of substance use disorder,
Okay.
and the syllabus talks about this too,
Okay.
is the concept of comorbidity.
Comorbidity.
Yeah, it's a big word.
What does that even mean?
So it just means that there's two or more conditions or illnesses in a person.
Okay.
So in the context of substance use, it often means that substance use disorders frequently occur alongside other mental health conditions, like depression, anxiety, PTSD.
So it's not just about treating the substance use.
What
You
is
also have to look at their mental health.
Exactly. Treating one without the other is often ineffective.
Right.
You can think of it like trying to fix a leaky faucet
Okay.
without addressing the broken pipe that's causing the leak in the first place.
Wow, that's a really good analogy.
It really highlights how interconnected everything is.
Yeah.
So we need an integrated approach to treatment
Okay.
to address both the substance use disorder and any underlying mental health issues.
So what does that look like?
So it requires a collaborative approach
Okay.
involving a team of professionals,
Okay.
doctors, therapists, counselors, and often peer support groups.
Okay.
Treatment plans really need to be individualized,
Yeah.
taking into account the person's unique needs and circumstances.
So it's like creating a personalized roadmap to recovery.
Exactly. It's not one size fits all.
Yeah.
And it's also important to remember that recovery is a journey, not a destination.
Right. It's a process.
Yeah, exactly. There will be ups and downs, setbacks, triumphs,
Right.
but with the right support and resources, people can and do recover.
It's good to hear.
Yeah, and that's a message of hope that I think is so important to emphasize.
Yeah, I agree. This has been really insightful.
Good.
We've covered so much today.
Yeah, I have.
From the basics to, like you said, that comorbidity, which I think is so important. And I'm also really interested in this idea that harm reduction and abstinence-based approaches can work together
Yeah,
to create a more effective system of care.
I agree.
Yeah.
It's about moving beyond the rhetoric and recognizing that there are many different pathways to recovery.
Okay, so for our listeners out there,
Yeah.
what has resonated most with you?
Yeah, what stands out to you?
I think for me, what really stands out is how interconnected everything is.
Yeah.
You know, we've talked about family dynamics, school environments, community efforts, harm reduction strategies.
Mm-hmm.
It's not just about the individual's choices.
Right.
It's about creating like a whole system of support
It is.
that addresses substance use on all these different levels.
Absolutely. Substance abuse doesn't exist in a vacuum.
Right.
It's influenced by a whole web of factors.
And you mentioned something earlier that I found really interesting.
Oh, yeah.
This idea that successful prevention
Mm-hmm.
often starts with addressing the underlying factors,
Mm-hmm.
like the social determinants of health
Yes.
that makes someone more vulnerable to substance use in the first place.
Absolutely. Things like poverty, trauma, lack of access to education and healthcare,
Right.
those can all create an environment where substance use is more likely.
And the syllabus talked about some programs that are trying to tackle these issues.
Yeah, there are some really innovative programs out there.
Oh, what kind of programs?
So one example is a program that provides job training and employment opportunities to people who are recovering from substance use disorders.
So not just treating the addiction, but
No.
also helping them get back on their feet.
Exactly. Giving them the tools and support they need to build a stable life.
Yeah.
Another example is a program that focuses on trauma-informed care
Oh, wow.
for people who've experienced childhood abuse or neglect.
Because trauma can often lead to substance abuse.
Exactly. And by addressing that underlying trauma,
Right.
we can help people break free from those unhealthy coping mechanisms.
And find healthier ways to cope.
Right.
So it's about recognizing the whole person,
Exactly.
not just the addiction.
Mm.
And are these programs having success?
Yeah, they are.
Awesome.
One study found that people who participated in a trauma-informed care program were significantly less likely to relapse
Wow.
than those who received traditional treatment.
That's great.
And another study showed that people who completed a job training program were more likely to maintain employment and stay sober.
So we're actually seeing that these holistic approaches are making a difference.
Yes, we are.
That's so encouraging.
It is. But there are still challenges, of course.
Oh, yeah. Like what?
One of the biggest, and the syllabus highlighted this, is funding.
Ah, yes, funding.
It's a big one.
Because you can have the best program in the world,
Right.
but if you don't have the money to run it.
Exactly. We need to advocate for increased investment in prevention and treatment services.
Yeah, and it's not just funding.
Right.
There's also stigma.
Yes.
Yeah.
Stigma is a huge barrier.
Yeah.
And access to care.
Like people might want help,
Exactly.
but there might not be any available.
Especially in rural areas.
Right.
So we need to create a system that's well-funded, accessible, and welcoming.
Yeah, for sure.
And that's where community involvement comes in.
Yes.
We can all play a role in advocating for change, supporting local organizations,
Absolutely.
and creating a more compassionate and understanding environment.
This has been such an eye-opening conversation for me.
Good. I'm glad.
I feel like I have a whole new perspective
No.
on substance abuse prevention.
Mm-hmm.
And it's given me a lot to think about in terms of how I can be a part of the solution.
That's great to hear.
Yeah.
It's an ongoing conversation,
Yeah.
and there's always more to learn.
Mm-hmm.
But this has been a really good foundation
Yeah.
for understanding the complexities and the approaches to prevention and treatment.
So as we wrap up this deep dive,
Yeah.
we want to leave you with a final thought.
Okay.
You know, we talked about all these different levels of prevention, addressing underlying issues,
Yeah.
and the power of harm reduction strategies.
Yeah.
But where do you see yourself fitting into all of this?
That's a good question.
You know, whether it's educating yourself, supporting a loved one, advocating for change in your community.
Mm-hmm.
Remember that every action, no matter how small, can make a difference.
Well said. We all have a role to play in creating a future where substance use disorder is less prevalent and the harms are reduced.
Yeah, I love that.
And by working together, I think we can make that future a reality.
Thanks for joining us on this deep dive, everyone.
Yeah, thanks for listening.
We hope you found it informative and thought-provoking.
Mm-hmm.
Until next time, keep exploring, keep learning, and keep diving deep.